Greetings, New Zealand naturopath Eric Bakker, author of Candida Crusher and formulator of the CanXida range of products. Thanks for checking out my video. I have a request here from a lady called Natalie in Sweden. Natalie's quite a remarkable lady who set up a Facebook page, a Swedish Facebook page for people with Candida yeast infections, but also all different kinds of problems and health issues related to Candida. So Natalie's asked me, Eric, can you please talk about urethritis? So urethritis belongs to a category of problems called urinary tract infections. So there are different kinds of UTIs, or urinary tract infections. Urethritis relates more to an inflammation of the urethra, which is a conduit, or the little tube that runs from the bladder to the outside of the body. We've also got other conditions, of that. We've got cystitis, which is really the bladder infection or the reservoir of the urine to which the urethras are attached to, and they move on out to the body towards the urethra. We've got prostatitis that males can get. We've got pyelonephritis, which is a kidney infection, kidney inflammation. A person will get fever and chills and like pain in the back, like they've been kicked in the back by a horse or something like that. Urethritis is actually quite a common condition, and it can affect men and women both equally. It can affect young people and old people, and there are different reasons why these particular type of age groups will get it. And so let's go into that a little bit. So men can be quite prone to urethritis, even though they've got a longer urethra. They can be certainly prone to it. They tend to have a thinner mucous membrane lining the urethra than women do, who tend to have a shorter one and a thicker one. So women tend to have urethritis, particularly as they get older, much more prone due to estrogen and progesterone. So estrogen has a very big effect on maintaining the integrity of the urinary tract. So older women can be much more prone to urinary tract infections than younger women, and I feel because they have these big problems with estrogen and progesterone. So it may pay to get your hormones checked out and maybe balanced or fixed up if you are certainly an older type of person. With the younger ones, most cases of urethritis, I find, is due to after having intimate relations or after sex. So it's important to go straight to the bathroom and to urinate after that and make sure that the hygiene is very good. If you get this infection, try and find out what it is. Is it a Candida problem? Is it a bacterial problem? Is it virus? What's causing the actual infection? Doctors will routinely give antibiotics, which is crazy, because if you don't know what you're doing, you're just giving antibiotics routinely, you could be causing a big problem for yourself and just destroying a lot of normal flora while not even affecting the bug that's causing the problem in the first place. If it is bacteria and it's E. coli or Escherichia coli, try a powder called D-mannose powder. I'll write that down for you. So mannose is basically a particular kind of sugar. Now don't worry about Candida, okay, because you're not going to have a big issue with Candida with mannose. And just write this down for you. So you can buy this quite easily if you can't contact me. Mannose, it's a type of powder you get in a little tub, and you take that once or twice per day if it's an E. coli infection. Now, you can use D-mannose for any kind of E. coli urinary tract related infection, and E. coli is a very common cause of a lot of these urinary infections. It's a common bacteria, and it can be transferred from the rectal region to the urethral region quite easily, especially with intimate relations. So mannose actually acts a little bit like Velcro. You know what Velcro is? That stuff that goes when you rip it apart. It's got all the little plastic hooks on one end and that funny stuff on the other end. It goes shh, and you pull it apart. And so what the mannose does is it actually hooks up to the E. coli and pulls it out of the body. So D-mannose sticks to it and can't be separated. And you pee out these compounds of D-mannose and E. coli bound together. And it's very effective. And if you keep taking D-mannose with an E. coli urinary tract related infection regularly, you'll find the symptoms will go ning, 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 gone. Okay? Now cranberries are also very good for this particular problem. But here's the problem. Most of the cranberry juice you buy in the shop is crap. It's crap. It's like, you might as well drink Coca-Cola. It's full of sugar. All right? So if you're going to want to go the alkaline way for urine, and try and really nail this infection, through that alkaline sort of cleansing of the urinary tract, then I'd recommend you buy the proper cranberries from the health food shop. Make sure their cranberries are not some Chinese import moo berries or whatever you get. Make sure they're the proper real thing, okay? They have to be cranberries. And you're going to use 1 tablespoon of these, and you're going to put it in quite a large cup. I have a large cup here. Now, that's just a normal cup, but probably a cup, a bit bigger than that. You put probably a level tablespoon into that, pour it with boiling water on top, and then cover it and leave it for a good 10-15 minutes. Now that can work quite effectively, and you can use the cranberries at least twice, if not 3 times, doing that. Or you can make a small pot of tea with the cranberries. Put a couple of tablespoons in there, boiling water, cover it. If you make herbal teas, don't put the herbs in pots you've had normal tea in. Buy a brand new ceramic pot and just keep that for that one particular herb. It's much better. So having usually about the standard dose for something like a cranberry, I would say, if you look at the old-fashioned herbal way, we used to prescribe in a wine glass full. So I'm sure some people out there drink wine, am I right? So how much wine would you put in a glass? Well, it depends on the glass and how much you like wine, I suppose. So some people put that much in, some people put that much in. But how much you would drink in 1 wine glass is a dose for the cranberry. And you have about 3 wine glassfuls or 4 wine glassfuls of that herbal tea per day, okay? So you can make an infusion or a decoction. The infusion is when you let it steep like tea. The decoction is when you simmer the cranberry. You put it in a pot, a stainless steel pot on the stove, and boil it, and then turn it right down, have a gentle simmer for about a good 10 minutes. That's a more powerful way to take it. You can also do cat's claw. Cat's claw is a very good antifungal herb, especially for Candida, but I know it's very successful also for urethritis. You actually buy cat's claw powder or cat's claw bark. I hope you can get it in Sweden, or you can import it. I know they're quite tough there with customs, but cat's claw comes from South America. Una de gato, I think, is the other name for it. It's very, very effective for urinary tract issues and bladder problems in general. So those are a couple of good tips for you to use. Now, I've done a video before on, I'm not a huge fan of alkaline and acid when it comes to diet, but when it comes to urinary tract infections, I am a fan of alkalizing, okay? So you need to alkalize, and the best way to do that, I think, is herbal medicines, much more so than foods. Now, as I mentioned, if you're perimenopausal or menopausal, sort of like 45, 50 or older, get your hormones checked out, especially if you get regular urethritis. You want to get that checked. So I'm just going to read on some notes I've made here. Some other tips here. Another one is a sitz bath. So you can just sit in a nice small bathtub, fill it up with quite warm water, and that's going to really help to settle the symptoms right down quite a bit. Hygiene we spoke about. Now with guys, if guys have got the urinary issues, urethritis, anything like that, they should obviously use condoms and things like that if they're going to have sex. It makes sense until any kind of infection clears up. And it's the same with females. You need to be careful with intimate relations with infections, that you don't pass the parcel from one person to another. Okay, we don't want that. That's not really nice. And of course, drinking a lot of water. Water is a good thing to do when you've got a UTI. Lots and lots of water. Any kind of urinary issue. I don't recommend that you drink lots of coffee and tea and schnapps and vodka and all that other stuff. So I know in Sweden they like to drink alcohol. Well, I suppose everywhere they like to drink alcohol. So when you've got any kind of infection, you want to really stop drinking all alcohol and cut your coffee down to 1 per day and drink more of the green teas. It's going to work. When it comes to food and urinary issues, I think you should back off the protein and eat lighter. So eat fish, or even eat legumes, or go sort of like a vegetarian for maybe a good week or 10 days. And the thing is, you need rest. You need lots of rest when you've got any kind of infection, so your immune system can get stronger and more viable and fight the infection. So far we've mentioned some different natural aids. We've mentioned particularly the cranberry. We mentioned the sitz bath. We mentioned resting. We mentioned ceasing alcohol, cutting coffee and tea consumption back, and drinking a lot of water. Those are all very good tips for urethritis. So give those a go. The other thing is, don't forget, I've got a nice report to give away for free for people who join my list. So if you want that, click on the link in the box below, and you can get that nice Candida report off me. If you're not a subscriber, please subscribe. And thanks to Natalie for asking that question. Thank you.